Did you hear about the 15,000 nurses that actually walked off of their job from the hospitals back in up in New York? I know
I
you were
did.
trying to. I think you were talking to me about that before.
Yeah, yeah, yeah.
Give me more. Like, what is going on?
So, and at a few hospitals in Manhattan, actually the hospital that I was born in, Mount Sinai.
Yeah.
That's actually a prestigious hospital because John Lennon died there.
Dang.
Yeah,
I didn't even know
when they
that.
murdered him, they sent
Wow.
him to Mount Sinai.
Dang.
Yeah. So the hospital got motion, but other than that, yeah. So there was a strike, and nurses ended up bouncing and stabbing out at the work spot because they was just um, they wasn't feeling the work environment
Yeah, the
that the
agreement that
hospital
they
that the hospital was providing. So as far as
like safer staffing
exactly,
levels,
so
improved
staffing and
workspace
census,
safety
yeah,
protections, maintenance of health benefits without cuts,
exactly,
better pay and contract
benefits,
terms,
all
all
that.
that protection against misuse of artificial intelligence in workplace.
That's why, yeah.
Whoa. Why don't like but everybody's oh my goodness. And
What's
then we
up?
have the whole government shutdown. Well,
Mm-hmm.
almost,
Yeah.
with the funding with that, I guess. So what what is what could
So being a first responder, and just being
right because
within
that's do
arm's
you feel like
reach
that's
from
eventually
that.
going to affect you?
So I believe it. Of course, if I was in New York and I was working in New York, then it would have had most
So is it
definitely
just state
affected
by
me.
state?
Yeah.
This is going oh
Yeah,
wow.
because I believe it has something to do with the union and the restrictions and all of that within the state of New York. Um, but yeah, they was unhappy and unpleased with the working circumstances and the work environment, and I completely feel them as far as walking in to your shift and not having a sufficient amount of individuals or bodies to be
Yeah.
able to work alongside, you know what I
Right.
mean? So it makes your workload pause. It makes your work for the day
Yeah.
even more, you know what I'm
For
saying? So
sure.
like whether you got 5 or 6 patients, that could put you at 10 patients,
I
you
feel
know what I
like
mean?
that alone in that field alone, that job,
Mhm.
the first responders, they need help.
Yeah,
So it's
most
like,
definitely.
why can't they get the actual the need? They're just
Yeah,
asking for, you know,
right.
the
What anybody
assistance.
else
Like,
is.
if
Mhm.
we can just provide for, I don't even know. I'm not trying to like offend anyone,
No.
positions or jobs,
No, not at
but if we
all.
can provide for these other type of workers,
Mhm.
that's working for the government or whatever, for
Right.
federal, we definitely need to protect the nurses or help them,
Most
aid them,
definitely.
because this is our future. This is the
Mhm.
now. This
Yeah.
is,
Yeah.
but it's always something when it comes to health. I
Mhm.
feel like with this country, we're
Yeah.
never doing our job. Like other
Mhm.
countries where they have free health
It's
care. They
never
have,
enough.
it's
Mhm.
never.
Yeah.
Mm.
And then even as
So
far as
what pushes you? What motivates you to further
you know
your
what? I
career?
enjoy what I do more than anything. I enjoy what I do. I enjoy being able to assist and help people to continue to progress and get healthier, get better. Um and I'm very empathetic for those who are ill, and you know what I'm saying. So in that dynamic, I enjoy what I do.
I love it.
I always go into work and I always learn more than what I knew the day before.
Good.
You know what I mean? Even if it's just familiarizing myself
Yeah.
with charting, or you know what I mean,
Right.
like
Right.
speaking to physicians, or you know what I mean, like
Yeah.
just establishing that communication
Mhm.
or whatever. Because a lot of people, they get a little intimidated by talking to the physician or talking
Mhm.
to the hospitalist or reaching out to them to let them know about labs or
Mhm.
anything like that. You know what I mean?
Yeah.
It kind of gives you like a butterfly in your stomach kind of feeling, and be like, oh shit, I gotta hit this nigga up to let him know about these labs that I received that, You know what I'm saying? Don't look well for the
sure.
patient, to where it might be leading them to a critical status. You know what I'm saying? So yeah, no, just even that, like the constant repetition of having to do that. You know what I mean? And just building the confidence to do that, and not having to, you know what I mean, like continue to read in their charts or whatnot.
To proper have like production, you know, the proper, what is it, 5 P's? Proper preparation prevent poor performance.
Exactly.
Yeah. So.
Exactly.
Yeah. It's true.
Yeah. So yeah. Other than that, enjoying myself, learning more every day. You know. So those two things alone, they definitely encourage and promote me continuing to want to pursue, you know what I'm saying, my career and everything like that. And not for nothing, when you think about it, my workspace, my work environment is 85-90% women.
Right.
All yearners.
Yes.
You heard?
We're going to be like, hey, sir, her, hello, get over here. What? If you're not doing it right, get the...
And
it's
I
like
mean,
that?
For sure.
Not really. They're nicer.
Nah. I mean, you got dickheads in every work
But do
spot.
females favor you because you're the like one of the needles in a haystack to be in the field?
I don't necessarily feel like they favor towards me, but I do feel like because of my work ethic, how I approach work,
they appreciate
I'm always willing to give a helping hand.
Yeah.
You know what I mean? And I feel like I have good time management.
Okay.
As far as my,
you don't have it here.
My expectations.
Okay. You definitely don't have it here. Oh my God.
Don't do that. Don't do that.
Is it because I'm black? That's crazy. I knew it. You see, it be your own kind.
You see what I'm saying?
They don't take you serious.
They'll do it to you, dog.
It's all right. They're gonna
but
do it
yeah, I feel like due to my time management and always putting myself in a position where if I do get a call to help this person when I'm in the middle of something, I can hurry up and finish what I'm doing, go tend to you and help you with whatever you need done, and then I can get back to, you know what I'm saying, my regular routine.
You're pretty efficient. Yeah, I like that. You're very handy. Instead of just in the way, like, enough. Grow up.
but yeah, and from that, I do feel like I get a few more calls than your regular average.
Calls, like to come in, like to be like,
so like they'll bang your line on a little Vocera on the walkie-talkie.
Really?
Some hospitals use the actual Jack Mac. They'll give you a cell phone. And,
for real?
Yeah. Not like for you to take with you, but when you working, they'll
during the shift, like, or when you're home.
No, when you at work.
Okay, gotcha. They'll be like, hello,
exactly.
We need you. That's good. Yeah, utilize me so this time can go by.
Exactly, and more than anything, that's what I really look forward to, is making sure that I stay busy.
Yes.
And it just stays consistently flowing.
Because an idle mind is a devil's playground.
Exactly.
Remember that, kids.
Exactly.
Yeah.
And then for nothing, you're going to fuck around and get yourself tied up into some bullshit because you're on your phone.
Literally.
You know what I'm saying?
That's bad. But I love that you take pride in your work. It shows.
I do. Thank you.
Yeah. That's
Thank you. You as well.
Thank you.
You know what I'm saying? For
Thank
sure.
you.
Real recognize real.
Thank you.
Oh, you pulling the sleeve
Scrollex.
No, I was about to say.
I ain't got no watch on today. You know
I ain't seen it in a few weeks, dog.
I know. I had to donate it.
Donate?
No, I had him on last week. You wasn't here. Of course. That's why you ain't see it in a few weeks.
Excuse me. Pardon my.
I never donated a Rolex. I'm donating you before I donate that.
Oh man, I ain't even mad at you.
I would donate that if I got another one.
yeah. You gotta replace that one.
Replace it. You know what I'm saying? And I would.
Sure.
I would.
But I miss seeing you with the stole on.
Yeah, I wanted to calm down a little bit, you know what I'm saying, blend in with the.
You be wearing that shit so baggy, not for nothing.
I know I gotta get it tightened, but I like it. No, that's nasty. I'm sure. I just I don't care. I just
what you was about to say? I like it loose.
Yeah, that was hey yo. What y'all get?
Oh man,
so what we rocking with next? What you rocking with?
You be wearing that shit so loose, nigga. You could fuck around and wear that shit like a headband. How big your head is? You could walk around like the Monopoly
little
man.
Ass body could fit in that bitch. Head first, dive.
Yeah, I'm diving.
Little ass.
Yeah, off the diving board.
No,
for
from
sure.
right here. That's how little you could jump from here to the ground in that bracelet, and you would still be like,
Yeah.
I'm drowning, your little ass.
Tone.
Help.
Yeah, Tone could fuck around and wear her stoley like a monocle, like the Monopoly man.
Whatever.
Not for nothing. I need to make some merch and put your face with the rollie on.
Nah.
And then just make you the new Monopoly merch. For sure. That works. That works.